In the next few minutes, I'm going to show you how to easily shop for Medicare Advantage plans online with our new free and simple to use Plan Finder tool that will allow you to compare Medicare Advantage plans side by side and view all of the benefits of the top Medicare Advantage plans. Hi, if we haven't met before, I'm Chet Kuhn with Medicare Hero, and follow along as I walk you through step by step how to use our new simple and easy Plan Finder tool that we just made available starting in 2020.
All right, so you can access our new Plan Finder tool by going to the URL address shop.medicarehero.com, and it will take you to this landing page right here. Now, there's two different ways you can get started. You can either go directly and view plans that are not personalized for you, or you can do what I recommend and click on the Help Me Choose button. We'll just walk you through and help you customize your results based on your medications that you currently take. So I'm going to start by clicking on Help Me Choose. Next, we're going to enter our zip code. Now, if your zip code overlies multiple counties, it'll just ask you to select which county you're in, and then click Next. And then it'll allow us to enter our prescription drug list. So what you can do is just start by entering the first three letters of each of your medications, and it'll pull up a list of medications that you can choose from. So in this case, I'm going to type in LIS, and our medication that we're looking for is lisinopril. Next, it's going to ask you for the dosage that you take, or how many milligrams. I'll select 10 milligrams. And then it'll ask, how often do you refill this medication? Do you refill it every month? Or do you get it every 3 months? And so forth. We'll say we get it every month. And then the final thing it'll ask is, how many do you get per refill? In this case, we'll say we take lisinopril once a day, so we get a quantity of 30 tablets each month. So we'll just leave that at 30, and we'll say Add Drug. Now, as you add medications, you'll see your medication list down here will grow. So if you ever need to remove a medication and alter it, you can do that right here by clicking the X. But we'll go ahead and add a second medication. I'm going to type in Adverstatin, ATO for Adverstatin, which is a high blood pressure medication, excuse me. If you ever see a medication highlighted in yellow, that's just telling you the most common dosage. So if you don't know what your current dosage is, you want to go with the one highlighted in yellow because that's most common. Again, it's going to ask you how often you refill this medication and the quantity per refill. We'll say Add Medication. And you can continue doing this until your medication list is full. For the sake of this example, I'm going to scroll up and add one more medication called Eliquis. Let's see here, E-L-I, and you'll scroll down and see Eliquis right here. I'm going to select 5 milligrams, which is the most common dosage. We're going to say we get this refilled each month, and when we get it refilled, we get 30 tablets at a time. So we'll say Add Medication. So now we can scroll down and see our completed medication list at the bottom. If everything looks good, we can come over here to the right and just click Next to continue on with the quote. Now when you get to the next page where it says, how often do you see a doctor or receive medical care? This is an optional page, and in fact, I highly recommend just skipping past this page and not entering it. What this page is supposed to do is predict the healthcare costs or your co-pays for a particular plan over the course of the year. Through my experience working with clients, I find this just to be very confusing. So I highly recommend when you get to this page asking about how often you see a doctor or how good your health is, I just highly recommend you come down to the bottom and just click Next and skip right past it. Now this will take you to a page that will ask you to select your preferred pharmacy. Your pharmacy will default to the nearest major preferred pharmacy, but you can change that preferred pharmacy. You can select a local pharmacy if it's not a major chain that you use, or you can select that you use mail order if you typically get your prescriptions mailed. So whichever you prefer is the one you can select. I'm just going to select CVS Pharmacy for this example, and we'll click Next to continue on. Now the last step before comparing plans is to enter your current Medicare Advantage plan if you currently have one. This will allow us to compare our current plan to the other plans available. So as you can see, you can come over here and there's a list of all the different insurance companies available. And I'm just going to select a Humana plan, for example. and we're just going to select the Humana Gold Plus HMO, which is a very common and popular Medicare Advantage plan. And then once you select your plan that you currently have, you can just go over here and click Next to view your quotes. Now, once you get to this results page, the first thing that you want to do that I highly recommend is come up here to the top and click on the Save Progress button. That way we can re-access this personal information again in the future, and we won't have to re-enter our information to look at these quotes again. So click on the Save Progress button, and then you'll want to first write down your personal code. This is an 8-digit personal code that you can later enter to view your quotes, or if you need help from one of your agents, you can give us a call, and if you provide us with this personal code, we can pull up all of your quote information and walk right through your different quote options with you, hand in hand, and kind of explain any questions you might have and help you choose the right plan for you. We can even assist you with all of your enrollment paperwork. So make sure and first write down this personal 8-digit code. Next, what you want to do is come down and you'll see this little link right here, and you want to click on that link. When you click on that, what you'll notice is it's just going to take you right back to the very same page that you're just on. But what it does is it actually inserts your personal code into the URL, which is saving your plan results. So now if you refresh your page, it won't lose any of your results. It'll still have all of your information saved. So once you click on that link, then what you can do is, if you want the easiest way to return to your quotes in the future, is just click on the little bookmark star at the top of your browser. Most different browsers like Chrome and Internet Explorer, Bing have a star at the top somewhere where if you click on it, you can save this link. So I'm just going to type in Chet's Drug Plan Quote. Now I'm going to save that, so if I ever need to come back, I'll have this link saved so I can do so. Okay, so now that we got our quote saved and we wrote down our personal code, let's review our plan options. Now it's important to note that this tool allows you to compare and shop for not only Medicare Advantage plans, but also standalone prescription drug plans for people who have a Medicare supplement plan to go along with it, or original Medicare. So it's important to note which type of plans we're comparing. Since we're looking for Medicare Advantage plans, we're likely going to want to be on this first button. This is for Medicare Advantage plans that include prescription drug coverage. That's going to be for the vast majority of you looking for Medicare Advantage plans. If you happen to have a Medicare Advantage plan that does not include prescription drug coverage, or if that's what you're looking for, then you'll want to click on this middle option here. And then the final option over here on the right is for those standalone prescription drug plans. So since we're talking about Medicare Advantage plans that include prescription drug coverage, we're going to want to make sure that this box over here on the far left is highlighted. So just always double check that before you get started. Now, as we look down and look into our options, if you selected in the previous step which plan that you currently have, then your current plan will be listed here at the top inside of this blue border. So I selected that I had the Humana Gold Plus HMO Medicare Advantage plan, so it put it right here at the top for me. Now, the information it gives you is pretty helpful, and it gives you an overview of each plan available. It starts off with the plan name, the monthly premium that they charge, as well as an overview of some key benefits, like if the plan has a deductible, the copay for your primary doctor's office visits, specialist copays, as well as the maximum out-of-pocket that you could spend in 1 year on your healthcare services. So the maximum you could spend with this Humana HMO is $5,200 on your healthcare services in 1 year. It also gives you an overview of some other key features like dental, vision, and hearing. So if there's a check mark by the service, then then that means that this plan includes those key benefits. So this Humana plan has dental, vision, and hearing coverage to some extent. It also includes some information about your prescription drugs. This plan, it says, has a deductible of $200 for your prescription drug coverage, and it says that 3 out of our 3 medications that we entered earlier are covered by this plan. Okay, so and you can scroll down and look at the other various plans available to get an overview. Now, to see more details of any particular plan, all you have to do is click on this little details button. Now that opens up the the benefits details tab. What that will show you is a bit more about the details of this plan. Again, it tells you the monthly premium, the deductible for your healthcare services, maximum out of pocket. As we scroll down, it starts telling you more details. So this plan includes a fitness benefit or a fitness membership program. It includes a benefit for meals. So they will bring you up to 40 meals within 20 days after a surgery or procedure in a hospital, or any time that you're not able to get those meals prepared for yourself based on a medical service or treatment that you received. And then we can go down and we continue to see more services. This will explain more about the dental coverage built into a plan, about the diabetic testing supplies and services, and so forth. So you can go down here and look at all the various copays of a particular plan. You can also come back up to the top and click on the second tab over that's called Drug Cost Details. Now the drug cost details will take you through the specific details for your medications. So it's going to start by telling you a little bit of general information for each of your medications, which tier it's on, if there's any quantity limits, if there's prior authorization required, things like that. The helpful information comes down here when you look at the kind of the calendar summary. So what this is doing is this is predicting your particular medication costs each month of the year. So in January, it's predicting that your medication costs for each of your medications are as listed. You can go down for each month of the year and see what those medications would be. So it looks like with this Humana plan, our cost would be about $51 per month. We can go down here and view any month of the year. So it looks like for us, all year long, our copays are going to be the same, of about $51 each month. Okay. If you're new to Medicare, and let's say you're joining this plan in February, April, June, or any other month other than January, it's still going to list these costs the same way. So really just think of January as month number 1 that you have your coverage. February is month number 2 and going forward. So if you're not starting in January, it's still going to show you the information the same way. Just assume this is the first month you have the coverage, this is the second month, and so forth. If you would like to compare your current plan to one of the other plans available, you can come down and simply click the Compare button beside up to 3 different plans that you want to compare. We'll say we want to compare it with this United Healthcare plan, and click Compare. Now it shows you the exact same information we just went through, but it just shows it to you side by side so you can compare the various different benefits, healthcare benefits side by side, as well as if we go back up to the top and click Drug Cost Details, it will show us our expected drug cost details side by side for each month of the year. So this is how you compare plans side by side. Now, as licensed insurance brokers, we have access to even additional resources on our side of this tool. So if you would like help determining which networks your doctors are in, we have a tool that will actually look up and tell us which plans your doctors accept, as well as more insights into these plans. So if you have any questions, need help, or you're ready to sign up, feel free to give us a call. Our number is listed right here at the top of the page, and then make sure and write down this personal code, and that way we can access all the information you just entered and save us some time when we talk and help answer all your questions, and we can even help you with your enrollment right over the phone in just a few minutes. If you find a plan that you love and you're just ready to sign up, you can actually sign yourself up right online in just a few minutes. It's real simple. All you have to do is just click the green enroll button by the plan you want to go with, and it'll just ask you a few basic details, your name, phone number, address, Medicare number, a few things like that, and you can just submit your application right online in just a few minutes. Now, something we're really proud of as part of this new Plan Finder software is that we've partnered with the Feeding America program to provide up to 10 hot meals for seniors, veterans, and children in need for every enrollment submitted through this Plan Finder tool. So every person who signs up, that you sign yourself up on this platform, or if you give us a call, that provides 10 meals through the Feeding America program for seniors, children, and veterans in need. So it's a real good charity we're proud to be a part of, and we're proud to give back to the community that we serve. So if you need anything at all, feel free to give us a call. Like I said, our number is right here at the top of the page. We're here to help you any way we can, and we sure appreciate you following along and watching the video today, and we hope to talk to you soon.